Today we are doing a demonstration on a sterile dressing change. When you're doing a sterile dressing change, you first want to assess your patient identifiers, their name, date of birth, and make sure it matches their armband. You also want to assess your patient's pain level. So if your patient needs any PRN pain medication, you want to make sure that they have that beforehand. So when we go in and meet our patient, we first want to wash our hands and put on gloves. So our patient today is Mr. Kevin Reed. We can check our doctor's orders to see the location of our incision, our wound care orders, and what dressing supplies that we might need for the dressing change. So first we want to wash off our table, our workspace. You need our dressing change kit, which on the front here tells you what supplies are inside and what additional supplies that you might need to bring. So I brought in an additional ABD pad, a tray of cotton sponges that I will need to clean my incision, extra tea drain sponges. I will need a measuring tape, some extra tape, 2 pairs of sterile gloves, and a Chucks or garbage can to put our garbage. You'll need cleaning solution, and this is per your doctor's order. It will be either normal saline or sterile water, and then a pen to mark my dressing afterwards. So now we're going to position our patient. Only expose the area of the patient that you will be working with. I'm going to raise the bed to my working level. Because this is a sterile dressing change, I want them to be at my waist level. I'm going to lower the side rail. And then I'm going to put a Chucks down between my patient's lap. Okay. So now my dressing is exposed, and I want to take off the dressing layer by layer. So now I'm going to remove the dressing by removing the tape towards the incision, one layer at a time. And as I'm removing each layer, I'm assessing for code, which is color, odor, drainage, erythema, and edema. So once my incision and drain is exposed, I'm going to remove my dirty gloves and then do hand hygiene. I'm going to put on new gloves because now I want to measure my incision. My incision is well approximated with some erythema around the site. I want to count my sutures, 1, 2, 3, 4, 5, 6. When I'm measuring my incision, I want to hover my measuring tape above my incision, careful not to touch my patient, and it is about 7.5 centimeters. And with my Penrose drain, I want to take note of the direction it is pointing towards. So imagining that my patient is a clock, the head being 12 o'clock, the Penrose is pointing to about 4 o'clock. So once I have my incision and drain assessed and measured, I'm going to take off my gloves and do hand hygiene. I'm done with these clean gloves for now, so I'm just going to remove it off my table to get it out of my way, because now I want to set up my sterile field. Make sure to remove any items that you don't need for your sterile dressing change. So the first thing I'm going to do is open my dressing change tray, making sure that I don't hover over the opening of the tray. And then I'm going to carefully set it down on my table. This tray has a garbage receptacle sitting on top, which I don't need because I'm using a Chucks. So I'm going to reach in carefully and discard of it. So now I'm going to pull up my sterile field. When removing your sterile field, you want to manipulate it by the 1-inch border, keeping it above your waist. With this sterile field, you want to put the blue side down Some sterile fields have a shiny side that you want down to the table. So once it's down on the table, you can manipulate it by the 1-inch border, and you can move it side to side, but not up and down. So now I'm going to load my field. Keeping my tray down, careful not to reach too far over the 1-inch border. I'm going to load my supplies. Now I'm ready to open my additional supplies and load them onto my sterile field. I will need my gauze 4x4s to clean the incision. Anything that falls within the 1-inch border is considered dirty, so I cannot use that for my dressing change. So now that my sterile field is loaded, I'm going to pour my cleaning solution. I'm using sodium chloride. These are single-use bottles, and they are no longer sterile once you open it. So I'm going to palm the label, open my solution with the cap up, and then I'm going to reach in over the side and pour my solution. So I'm going to take a moment of pause to make sure that I have everything I need before I get my sterile gloves on. My incision is exposed. I have my cleaning solution. I have all my supplies on my sterile field. So now I'm ready to put on my sterile gloves. So I'm going to walk to the side of my sterile field here. I have 2 pairs of sterile gloves. I'm going to put one in my pocket in case that I need it. I'm going to move my tray over a little bit. Remember, you have a 1-inch border in case your sterile gloves reaches over your sterile field. Once you have both sterile gloves on, you can manipulate it by the palm and the fingers. I'm going to get rid of this wrapper. So now I'm ready to organize my sterile field. I want to make a dressing sandwich that consists of an ABD, 2 drain sponges, and a 4x4. That's what I'm going to use to cover my incision. I'm being careful not to reach over my sterile field past my gloves. So I'm keeping my arms in. I do have additional supplies on my sterile field. I can choose to leave it on my sterile field or remove it. So I have my ABD, my 2 drain sponges, and 1 4x4. I will also need a pair of tweezers for when I'm cleaning my drain. So I'm just going to set that to the side here so that I have it ready. Now I'm ready to prepare my gauzes that I'm going to use to clean my incision and drain. I will need at least 4, and depending on how dirty your wound is, you might need more. So I'm going to first take my 4x4 and make a little pledget or wonton. I'm going to reach in from the side here and dip it in my cleaning solution. So I'm going to set that to the side while I get my other 6 ready. Okay, so this is my 7th one. And I'm ready to begin cleaning. So when you're cleaning your incision, you want to clean from proximal to distal, cleanest to dirty. So I'm going to take my first wonton, squeeze out my extra cleaning solution, and clean from proximal to distal, right down the middle of my incision. You're allowed 1 swipe with each cleaning gauze. Next, I'm going to clean the side of the incision that's closest to me. Then I'm going to clean the side of the incision furthest from me. So now that my incision is clean, I'm going to clean my drain. Because my drain is sitting flush on the patient's skin, I can clean on the other side of the drain. So I'm going to take a wonton and clean in a half moon fashion away from my incision. Now I need to take my tweezers and pick up my drain because I need to clean the other side of it. So make sure you have a nice firm hold of your drain because if you drop it, you have to re-clean the whole incision and drain. So with the new wonton, I'm going to clean in a half moon fashion on the other side of the drain, away from the incision. I'm going to clean up one side of the drain and toss that. And the last thing I'm going to do is clean the other side of the drain. Now my incision and drain is cleaned, so now I'm ready to dress my incision. So the first thing I'm going to do is take a 4x4 and cover my incision. I might need another one if my incision is long, but one should be sufficient for now. I'm going to grab my drain sponges and cover my drain. And then I'm going to take my other drain sponge and cover the other side. Now that my drain is covered, I can drop my Penrose drain and toss my tweezers. I'm going to take my ABD pad, handling it from the side with the blue line because the blue line goes towards the sky, or you can manipulate it from the edges of the pad. And you can place that down over your incision. And this is a bigger incision, so I will need 2 ABD pads. So luckily I have 2 on my sterile field. Again, handling it from the blue side. I'm going to put it down. Now that my incision is covered, the sterile part is over. So I'm ready to tape my dressing. So I'm going to use my extra tape that I brought and tape it in a window fashion on all 4 corners. And because I used 2 ABDs, I want to cover up this where the 2 pads meet. I'm going to take a small piece of tape. Using my pen, I want to put my initial time and date it so that I can take credit for my work. You always want to assess how your patient's doing, if they tolerated the procedure. And when you're done, you want to clean up your mess. Make sure your patient is nice and covered. I'm going to put my side rail up and put my patient down into a safe position. The last thing you want to do is document. You want to document that you did the dressing change, how the wound looked, the code of the drainage of your incision and drain, and how your patient tolerated the procedure. You want to take off your gloves, throw them away, and wash your hands. Make sure your patient is in a safe position and that they have their call light.